at ERS in Amsterdam again, today with Professor Singh, and we're going to speak about COPD patients and the risk of having an exacerbation. Professor Singh, what are achievable goals for a comprehensive treatment of patients who are at a higher risk of having an exacerbation?
So this is a very important question. So for patients who are at high risk of exacerbations, there's lots of things we can do. We can make sure that they're on the right therapy, the right inhaled therapies. We have many therapies that prevent exacerbations. I think we can focus a lot on the level of support they need. So education, the type of social support they have around them. During exacerbations, patients often are quite frightened and they're not able to cope on their own. And if we can educate them and make sure that they have the right networks around them, they can cope better. Also, we have to remember activity. We have to encourage patients to be very active between exacerbations, and then after an exacerbation, it can help their recovery enormously if we can try and get them back to their normal activity levels as quick as possible.
And why is reducing the risk of an exacerbation so important?
Well, there's lots of long-term detrimental effects of having an exacerbation. In the long term, patients might lose lung function. Their activity levels during an exacerbation go down, and they may never get back to normal if we can't encourage them. We also have to think about the short-term risks of an exacerbation. So although exacerbations are commonly thought of as events that happen in the lungs, many COPD patients have cardiovascular problems. And often during an exacerbation, it's a problem with the heart that develops, and mortality in COPD exacerbations is often cardiovascular. And we also need to prevent the patients going into hospital and being in hospital for a long time, because once they're in a hospital bed, again, they lose activity, they become deconditioned, and it can be very, very difficult to get them back to their normal state. And this is what we sometimes call the vicious spiral, that when patients become deconditioned and they're not exercising like they normally do, they start to go down, and it's very difficult to get them back to where they were.
And how can we communicate better with patients around the risk of having an exacerbation prior to them having an actual exacerbation?
Communication. So doctors, healthcare professionals, we use our own language. We use technical terms that we understand, but patients don't often understand these words. So we have to learn to use their language, the language they understand, and then they will start to be better educated about exacerbations, the symptoms that they experience, the risks. And then they can understand the need to prevent them, but also how to appropriately manage an exacerbation.
Thank you very much.
Thank you.